You're listening to Community Voice PHL, an award-winning talk show that informs, engages, and inspires. Hey, thanks again for tuning in to Community Voice PHL Talk Show, a show that informs, engages, and inspires. You're tuning in to WPPM LP Philadelphia. And Community Voice is a talk show that highlights the value-based programs and services that people are doing all across the tri-state area and beyond. We feature amazing stories about engaging people who inspire you to get involved with building caring and prosperous communities. So once again, thanks for listening to Community Voice PHL, a talk show that informs, engages, and inspires. So I know all of my YouTube viewers out there, if you're looking at the screen right now, it's your camera. It's not us. It's your camera, so it's blurry. Don't worry about it. But in all seriousness, it's just a little technical snafu here. I'm trying to get the camera cleared up. But nonetheless, I'm excited about the show we're going to have today. You know, as always, we bring on guests that are doing amazing things, as we always do in the community. And I had the chance to meet this particular guest that I'm going to be soon introducing at a community event that was held, maybe it was about a month or so ago. Time kind of goes by because look, this year is almost over. So y'all know time just goes by. But nonetheless, I had a chance to meet this guest and we had a great conversation about the work that they were doing. And I just thought it was really important to really delve into more information about this, because sometimes when you come across individuals who are doing amazing work, and say, like, you know what, people need to hear about that. And this is a conversation that need to be had. You know, the challenges for women in psychiatric medical healthcare stem sometimes from hormonal changes, societal pressures, and higher likelihood of experiencing trauma, including gender bias violence. Those factors contribute to higher rates of conditions like depression and anxiety. Additionally, adding to that, biomedical factors like differing physiology combined with healthcare biases can lead to women's symptoms being misdiagnosed and or misinterpreted, leading to factors that can trouble their diagnosis and trouble their treatment. And I mention that because that's a topic that sometimes, you know, we may hear about it, right, and may read an article too about it, but we really never lean in and give it the weight that it deserves in terms of having a good conversation about how do we understand it? How do we, I don't want to say deal with it as if it's a thing that has to be just dealt with, but how do we, you know, manage it in some regards? And how do we just, again, build around making sure we can have the right supports for those women and those who are gender defined in the space, have the supports that they need. So I was fortunate enough, as I said, to come across Nicole Leighton, psychiatric nurse practitioner for 16 years, combined experience with psychiatric nursing and advanced practice in psychiatric nursing experience. And at her private practice, Willow Women's Psychiatric Medicine and Wellness, she treats women and gender diverse individuals with mental health and substance abuse disorders. And she has a depth of understanding women and gender diverse individuals and meets their needs and cares for them in a way that allows for them to express themselves in a path and put them on a way of healing. And I'm excited to have on Community Voice PHL, Nicole Leighton. Thank you for being on.
Hi, Jeff. Thank you so much for having me. And that was a great introduction. I'm really, really grateful to be able to come on and talk about women's mental health for gender diverse individuals. It's something that I'm very passionate about. I've worked in the field and now have my own private practice just to really continue to fulfill my goal of meeting women where they're at and really being able to address their psychiatric needs.
So give our listeners and our foggy viewers a chance to learn a little bit more about the work that you're doing and why it matters and makes it so important for you.
Sure. So I treat women during the lifespan with expertise in the perinatal period. So that's during and after pregnancy. I also treat gender diverse individuals. So that's female identifying, non-binary, those with the capacity to become pregnant. These populations are sometimes not heard by the greater mental health community. Some could say that they've felt gaslit in the past.
Really?
And a really good example of this is with ADHD, which I treat. And I treat it in women because it has often been missed. So you think of ADHD being diagnosed in childhood, and historically, it's always been the boys that get the diagnosis because they're tearing the classroom apart. The girls are spacey, inattentive, maybe a little talkative, disorganized, maybe procrastinate, but they're not behavioral problems.
Right.
So it gets missed. And then women spend their lives compensating, feeling overwhelmed, trying to keep ahead, and often being very successful. But at a certain point, really realize things are out of control. And then, if they come to me, they get an evaluation and get that diagnosis and get the medication they need to feel more in control of their lives.
So is it a space where, sounds like you're mentioning, where it starts earlier in life, and then because of that misunderstanding, is it really like, I guess, is it really like gender bias, period, in terms of girls do this and boys do that, and I'm from the old school, right? I'm an old dude now, right? So, and I say this because what I'm about to say is definitely going to sound old, but there was a thing back when I was younger. Boys would do certain things, and girls would do certain things. And now I'm just talking about athletics. I'm just talking about personalities and behaviors. And so a girl's doing something that society says a girl should do, but yet at the same time, it could be a challenge mixed in there. Is that sometimes what happens?
Yeah, I mean, I think so. Certainly, there's girls with ADHD who are hyperactive and impulsive as well as inattentive.
Right.
But the DSM-5, the Diagnostic and Statistic Manual for Mental Health Disorders that we use as kind of like our cookbook for diagnosing people, is really like gender bias towards males in terms of the criteria for ADHD. And we're learning a lot more about how it manifests in women differently, especially into adulthood. Yeah.
So when you're looking at that, young girls, is that where most of the misdiagnosis happens, or is it sometimes even when they get to adulthood and just kind of handle the challenges of?
Yes.
Yeah.
Yeah. I think it's misdiagnosed in childhood and the teen years. And then, as I said, women will overcompensate. They may have 2 hours worth of homework to do that takes them 4 hours because it's so hard to sustain their focus. But they get it done. And so I see a lot of women who are wildly successful. They have these careers, but they're really struggling. They feel like they're just treading water. And they're anxious. It creates a lot of anxiety and overwhelm. And once patients come back to me after starting treatment, they tend to say like how much less anxious they feel.
Yeah. Is that anxiousness? First, let me peel back, because I know a lot of our viewers and listeners are like, we want to hear Nicole's story. How did she get started in this space? Give us a little bit about your background. How did you get started? I know you have a cat, Jenny, right?
I do. Yes. And I'm from Philadelphia.
Hold up. Eagles fan?
I'm not a sport.
Yeah.
Sixers.
Okay.
Sixers.
The
like
words and
basketball.
expressions on this show.
I'm just not like a big sports fan.
I got you. I'm sorry. Go ahead.
So I came to nursing as a second career. I became a registered nurse in 2009. I worked in medicine, different specialties, including emergency, for about 5 years. But from the beginning, I always worked in some capacity in psychiatry and just really fell in love with it. And after about 5 years, I decided to specialize in it. And I worked with severely mentally ill people for a long time, both in hospitals and in the community. In 2018, I started graduate school to become a nurse practitioner, and I needed a weekend job. And I discovered this recovery house for women who were homeless and had substance use and mental health disorders. And so I took that job. It was the first time I'd ever worked in substance use. And I'll be candid, I am a person in recovery. And I just wasn't really sure if that was going to be a good fit. But it turned out to be amazing. I fell in love with working with women and really being there to support them through their journeys. And And as graduation approached, I was like, oh my God, like I don't want to stop working with women.
Right.
So I did find a job treating pregnant and parenting women with mental health and psychiatric disorders. And that really, the love of that work really brought me to my private practice.
Yeah. So that connects to perinatal care too, right? And talk about that, because oftentimes when society hears about, particularly women, they hear about postpartum, which, is very important, but there's layers to that too, right? So
Sure.
tell a little bit more about that, because, 1 out of 5 women suffer anxiety and 1 out of 10 men. There's a reason for that, right? Yeah.
Yeah. I mean, some of it has to do with trauma.
Mm-hmm.
For sure. I find a lot of the symptoms I treat, ultimately, I attribute to trauma. In the perinatal period, if you have a person who has a history of, say, depression or bipolar disorder, this can worsen during pregnancy because of the way the hormones fluctuate. So we find depression in pregnancy because it's related to the relationship between estrogen and serotonin. In the postpartum period, it's the same thing. That imbalance of those two hormones and the way that they interact with each other can create the depression that women sometimes experience. And, a lot of women are afraid to speak out about how they're feeling. They have guilt. They feel like they should be so happy. They're pregnant. The baby's here. And really don't always seek treatment until the symptoms are really severe and they're having difficulty taking care of themselves and the baby.
So it happens during pregnancy as well, the
Yes.
anxiety, depression.
Yes.
Have you found in supporting women in that space, is it which way? I don't want to say easier, because I don't want to minimize that space, but where do they find most of their challenges? Is it during the pregnancy, because it's just like, I'm pregnant, world tells me I'm supposed to be happy and joyful, but yet I'm challenged here.
Yeah.
And then I know, of course, afterwards, it's like, how do I handle this motherhood thing?
Right.
So
I think it depends on the person.
okay.
Like I said, if there's a history, it may worsen during pregnancy due to hormones, or you could have a totally happy, healthy pregnancy, and then the baby's born, and there's just a real dip in mood and desire to parent or mother, maybe difficulty bonding with the baby. So, of course, these are conditions that need to be treated.
Right.
To help the mom and baby thrive.
Yeah. And when you're getting them into that space, is there a process that goes beyond gender specific? Because I know you deal with those who have different genders that they define themselves by.
Yeah, I like to say that I'll treat anyone with the capacity to become pregnant. So if you're a trans man and you decide to carry the child in your relationship, I will see you if you need care for mental health or substance use disorders, and carry you through the perinatal period if that's where the concerns are.
Is the psychiatric treatment different because of their gender definition and that transition they're going through? Does it create the hormonal differences in the response to the body mentally? And
it depends. Let's say I'm seeing a person who's trans and who's taking hormones. That could, estrogen therapy, testosterone therapy definitely has an impact on mood. And people may need support with medications to help balance that out. A trans man during pregnancy would not continue taking testosterone, but could still just have an organic depression or anxiety that worsens in pregnancy or in the postpartum period. But I think, the difference is there's a difference between cisgender women and non-binary folks, female identifying trans women, trans men. So it's really being able to address everyone's individual needs, from a person-centered place.
Yeah. And that's great that you mentioned that, from that person-centered space, because when we are with people, around people, we want to understand, how do we deal with them as a person, right? And in dealing with them as a person, that encompasses their experiences, that encompasses their neighborhood surroundings. So it encompasses all of that, which makes them the person that they are for a lot part. And I'm not talking a nurture nature thing, but there's some preponderance of truth to that experience of life makes them the person that they are. So in your 16 years experience of supporting all the, how do you mastercraft that in your skill set?
Yeah. So I mean, we learn about person-centered care as a nurse from day one, but I will say that my work with people with substance use disorder has really helped me to craft that. It starts with the language. I never use the term addict. I use the clinical term. It's a person with a substance use disorder, or this is a person who uses drugs. It's person first. I don't use terms like addicted baby for my patients that have babies that are born with neonatal abstinence syndrome or neonatal opioid withdrawal syndrome. So it's really just like changing the language, changing how I talk to and about people with substance use disorder, particularly to other providers, because they go into the healthcare system and there is so much stigma. There's already stigma for people who use substances, and then you tack on pregnancy, and they become the most stigmatized, and they are the most vulnerable people who really need treatment and care.
Yeah, that goes like, it's like a double label, where you get certain people get, they can say double label. And I'm glad that you brought that up as well. So let's talk about wellness for a moment. And I know it's a vogue term, wellness here. Well, and I get it. And I'm not, again, talking down about it, but let's bring some central understanding and some context to that. What is wellness in its true meaning when you're treating your clients?
Sure. I mean, when I meet my patients, we talk about what their goals are and what their wellness goals are. And it helps guide treatment. And so wellness could mean I need to stop feeling depressed and be able to go to work every morning with a positive attitude, to be able to take care of my family, to be able to practice self-care in a way that I haven't been able to. With substance use disorder, it's interesting because for some people, wellness is total abstinence. For other people, I personally take a harm reduction approach, which means that abstinence is not always the answer for everyone, and wellness might look like drinking less or using less dangerous drugs.
So pause right there. I like that approach, right? And it's kind of nuanced in a lot of ways, but I know a lot of our listeners and viewers be like, what do you mean you're supposed to just stop altogether? What is this lady talking about?
Right.
So
we know that just doesn't always work.
Yeah.
I mean, I think a few things. I think the road to abstinence involves relapse. I think of recovery as cyclical, not linear. So that's part of my approach too. Like, okay, we're taking steps. We're in the stages of change. There's something called the stages of change where you go through a process before you get to the end point of recovery, whatever that is for you. And I can't really tell someone what their recovery is going to look like. They have to tell me, and then I can give them the tools to help them reach their goals. And those are wellness goals.
Yeah, and see y'all out there listening, that's people-centered approach. That's when you understand the person that you're talking to and the person that you're serving. How do you help them get to their end goal? And I know a lot of you were, when I was making light, and I'm sure a lot of you were serious, those almost shouldn't they just stop? Okay, yeah, maybe for that person, but for this person, this is what their approach looks like, and that's how we begin to be people-centered in that approach. So thank you for laying that out. And those who have any emails or comments, you can always email us at communityvoicephl@gmail.com for any comments, feedbacks, or thoughts about this episode or any previous episodes. We welcome your conversation through the email platform, because we know that this is something that will generate some conversation, and we're hoping it does, because it opens up the understanding of how we can continue to support and be there for the women and those who are defined as gender specific in this conversation to get the support and treatment that they need. So panic disorder, I want to talk about that a little bit, because of course we know about the perinatal part, but there's also a part of panic disorder that women, I don't want to say suffer more, but experience more in some regard. than men. Is that because of the gender? Again, I'm going back to the gender bias. Is that because of the gender bias? Because women are looked at a certain way and shouldn't act a certain way, should behave a certain way. So now, when certain trauma hits them, it gets to that panic stage. Is that any truth to that, or?
I mean, I think, men experience trauma too. You have veterans that have panic attacks as part of their PTSD experience. The women I work with who have panic disorder, it's usually associated with a generalized anxiety disorder where, they have these episodes of extreme anxiety where they might have palpitations, chest tightness, chest pain, shortness of breath, feelings of doom, like they're going to die. Sometimes they go to the hospital thinking they're having a heart attack. And it comes out of nowhere. It often isn't triggered by something they're thinking. And I think I don't think it's gender specific. I do think more women suffer from anxiety than men. We have data that shows that, but so you could think that panic disorder might occur more in women in that sense, but I've been working with women so long at this point that I probably can only speak to their experience of the condition.
Well, I mean, but that's important to have that voice out there speaking about that, because I want the men out there who are listening to understand how we can be allies and supporting in this space without being so dismissive, right? And I say that because I think there's a lot of dismissive thoughts in terms of women in their mental health and wellness and some of the challenges that they go through, of course, by men, because again, society has just so pigeonholed, if you will, women to these categories, and even those who define themselves in that space, it's still so pigeonholed. So that, let me just put it this way: is the understanding of she's from Venus, I'm from Mars. Is that come into play?
I think women with mental illness need supportive partners. They need supportive families. I recently had a family meeting, right, to help explain medications during pregnancy and what to expect when the baby's born and how the baby might be responding to some of these medications. So having that kind of support and understanding is really important. And not every woman has that. And it can lead to really feeling isolated. It can lead to a delay in seeking care. It can lead to them thinking, like, doubting themselves. Like, am I crazy when I think that, something's wrong and maybe it's not.
Right. See, that's what I'm referring to. Is that inner battle where, like, is it me? Should I not feel this way that I'm feeling, even though what I'm feeling is valid?
Right.
Yeah.
Or that it feels so real.
Yeah.
And
talk
that
about that.
It needs to be validated.
Yeah.
And that's what I try to do when I meet with my patients for the first time and we do a psychiatric evaluation. And I really try to identify what's going on and validate their feelings for them with, hey, this is a diagnosis, and there's treatment for this. And I think that the hope that I can try to give someone in that it makes me hopeful, right? When I see someone doing well after treatment or during treatment, I carry that hope with me in my life.
Yeah. Yeah. And that's the human part of it, the altruistic part of it, and that's the joy of it. And I appreciate you sharing that, because many of our listeners and viewers know my story, how I used to work for a Fortune 500 company, but I left that company because I really didn't get that connection to making a difference as what I'm doing now. So I can relate to that. And when you share that story of, makes you hopeful, because look, and it's not like you're being braggadocious or anything like that, but it's just the fact that, I actually help someone, and that's meaningful. And I kudos to you on the work that you're doing. So keep up that great work. How can someone get in contact with you? They may be saying, hey, look, I'm going to come visit, come get some support and things. Sure. Before you answer that, though, you mentioned something I do want to dovetail on about that family support. Yeah. And how essential is that? And what does that family support looks like? Does it have to be, the nuclear family structure? Or can it be like your tribe community family? What is that?
It can be your friends. It can be your partner. Even your colleagues at work. You
Mm,
know, some people need accommodations at work,
mm-hmm,
and being able to be open about
mm-hmm,
that and get support is important. I think, you know, always having that support system open to speaking with a provider,
mm-hmm,
as long as the patient gives permission, I
mm-hmm,
think can really help shed light and understanding on what's going
mm-hmm.
on with their loved one.
Is there any accommodations at work? I know that's sometimes challenging in the space of employers not,
Mhm.
understanding, if someone comes and says, "Hey, I need this accommodation." Do you think that's part of their hesitancy because they might think the employer might say, "Well, we can't do that, and we gotta."
Yeah, I mean, I think it's hard to
Yeah.
disclose when
Hmm.
you have a mental health condition
Hmm.
and need help, especially in a place where you're kind of supposed to put on, you know, like
Hmm.
you're doing great. Um,
Yeah.
but we do have the Americans with Disabilities Act.
Hmm.
People can get accommodations which can support them at work,
Hmm.
so that they can be the best at their jobs.
Hmm. Have you had any clients come to you and experience that and, had to navigate through that as far as,
Yes.
yeah, yeah.
Yes.
Is that a
Mhm.
challenging conversation to have or?
Oh, no, I've actually supported people in getting accommodations at
Oh,
work.
okay, okay.
Yeah.
Well, talk about that. What was the
Um,
step in that process?
it's a lot of paperwork for
Yeah.
HR.
Hmm.
And you know, I just did my best to describe the condition
Hmm.
and how it could potentially impair their work
Hmm.
and what would support them the most. And in this case, it was remote work.
Got you.
So
Okay. Okay. Now don't go calling Nicole talking about y'all need remote work.
I know.
But in all seriousness, that is an accommodation that can help in that situation. And so does that employer, were they counting on you and your expertise to support what the employee was saying or?
Yes.
Yeah. Okay. And so is that kind of like the best path for someone to take in that to have an experienced provider service?
Yes, I
Okay.
would definitely go to HR,
Hmm.
discuss the situation.
Hmm.
They will want to reach out to the provider if you're in care
Hmm.
and have the paperwork completed.
And does that care have to be for a certain extended period of time? So, like, if you go to one or two appointments, would that count and then make that
I'm
accommodation?
sure if the patient's new to me, but
Mm.
I've given them a diagnosis and started treatment,
Mhm.
I'm happy to fill that paperwork out and support that person.
No, well, I guess what I was alluding to, like from the employer aspect, if the
Um,
employer says, "Oh, Jeff, you only had two appointments," that doesn't account for this account. Have you had any?
I haven't had any issues
Yeah,
with
okay.
that.
Because
No.
I just want to make sure that those aren't hurdles that come up along the way because
Sure.
the service that's needed is a service that's needed, no matter
Mhm.
how, in my opinion,
Yeah.
no matter how many appointments or sessions would need to be in place. If they come back and say these accommodations I need, it shouldn't be from some employers to say, well, you got to go a couple more times and get a couple more
Yeah.
diagnosis and all that. So
No, I think I did get some pushback about, well, why can't they do their job here?
yeah.
But the ADA laws are very clear,
Hmm.
and accommodations should absolutely be made for people who need them.
Got you, got you. The laws are very clear, but sometimes people have fuzzy vision.
It's true.
And we're glad to have you on the air to clear up some of those things. And definitely we'll want to have you back on as we get close to wrapping up this segment. Give our viewers and listeners the information how they can catch up with you and how they can, get some support from you in that regard.
Sure. You can visit my website, www.willowwomenspsychiatrywellness.com. I have a profile on Psychology Today. You can go to Psychology Today and search Willow Women's Psychiatry and Wellness or search Nicole Leighton, and my profile will come up and you can contact me directly through that profile. And I have just established myself on social media, so I do have an Instagram and Facebook page that you can visit as well. And you can call me directly at 215-975-1309.
There you go. And we'll have all that information in the show notes so that you'll be able to contact and support the work that Nicole Leighton is doing at the Willow Women's Psychiatry and Wellness. And be mindful that she will be back on the show to have further conversations about the great work that she's doing and some of the other supportive information. One last quick motivational word you got for the people?
Oh, oh God, Jeff, you put me on the spot. I
No.
would say seek to love yourself. And
There
know
you go.
yourself.
See, right on the spot, but right on time. Appreciate that. So we want to thank you all for listening to Community Voice PHL Talk Show, a show that informs, engages, and inspires. I want to thank our guest, Nicole Leighton, for being on the show and sharing all that great information that she shared. And just know, again, this will be on the show notes, how you can get in contact with her and support the work that she's doing and get more information for you or someone that you love and that you care for. But also know that as we continue to make a difference in the world, love yourself and love others, and that'll be the difference that we need to make along the way. So we appreciate you, and we thank you again for listening. And remember, if it's happening in your community, we need to hear your voice. Peace, and we are out.